my end.
That would be great, sir.
Sir, there is a share screen option is there, sir. You can-
Yeah.
Yes, sir.
I'll just go through that. It is there in my keynote. It's not minimizing here.
So meanwhile, Sri Vidya, you can start on the, you can just introduce, then after, yeah.
So good afternoon and a warm welcome to Vidya Jyoti Institute of Technology. We have all joined the third virtual webinar meet today, organized in collaboration with the VJIT National Service Scheme, NSS, and Dr. Reddy's Foundation for Health Education. Both DRFHE and VJIT NSS are together organizing these webinars for a noble cause, that is to disseminate valuable guidance in maintaining good health to all our stakeholders during this pandemic. Vidya Jyoti Institute of Technology is accredited by NBA, and NAC is affiliated to JNTU Hyderabad and approved by AICTE. It is a premier engineering institute ranked as the 8th best engineering college in Telangana by Times Annual Engineering College Ranking Survey. VJIT, a technical educational entity, aims at promoting the technical know-how, innovation, and entrepreneurship in the realm of science and technology, along with a focus on the all-round development for human welfare, for which we are continuously striving to maintain. VJIT offers undergraduate engineering programs in civil engineering, EEE, mechanical, ECE, CSE, IT, AI, and MTech and MBA in postgraduate programs. VJIT maintains a separate office and other facilities to run the NSS activities and programs in the college campus. The VJIT NSS unit organizes medical camps, awareness of nutrition issues among the villagers, environmental protection awareness programs, and need for education awareness program among the rural population. We have a Unnat Bharat Abhiyan Center at VJIT. UBA is a flagship national program of Ministry of Human Resource Development, Government of India, and IIT Delhi to develop villages in the vicinity of the working institution. Under UBA, VJIT has adopted 2 villages, Reddipalli village, Moinabad Mandal, and Aziz Nagar, Bakaram. On this note, let me welcome everyone who have joined the webinar on revised guidelines for prevention and management of COVID-19 second wave. I welcome our director, Dr. E. Sai Baba Reddy, principal Dr. A. Padmaja, senior AO, Mr. Chellam, academic coordinator, Mrs. Srilata, Dr. G. Narsimha, professor, Department of CSE at JNTUH College of Engineering, Hyderabad, and also the NSS program coordinator for all the JNTU affiliated colleges. I take pleasure in welcoming the speaker of today's event, Dr. Hiranappa B. Udunu, specialist in pulmonology, Columbia Asia Hospital in Hebel. And also he was a visiting consultant pulmonologist and sleep specialist who shall share today his valued knowledge and guidance on maintaining good health during this second wave of COVID. Also, I would like to welcome Ms. Lata Reddy and her team from Dr. Reddy's Foundation for Health Education. I welcome all the heads of all the departments of VJIT, our corporate friends, faculty, students, and most importantly, their family members also who have joined the session. Before we go ahead with the program, let me quickly introduce Dr. Narsimha, Professor of Department of Computer Science at JNTU College of Engineering, Hyderabad, and NSS Program Coordinator. He has been tirelessly engaging himself in enrichment of several national and state development programs by correlating himself with national and state bodies. He is proactive in participating and motivating thousands of students towards societal development programs in association with constituent and affiliated College of JNTU Hyderabad. Dr. Narsimha, who has been noticing the effective and progressive NSS events which are regularly being organized at VJIT, has joined us today. I take privilege in welcoming you, sir, and I humbly request Dr. Narsimha, sir, to briefly address the audience. Narsimha, sir.
Haresh, baglakondo bro.
Narsimha, sir, Dr. Narsimha, sir, can you briefly address before we start with the program. Giri Prasad.
Okay. Yes, madam. Yes, now I got it.
Okay.
Madam, just
You can
because
even-
it's in your hand. So, so respected dignitaries in the virtual mode. Today's chief guest, Dr. Hirinappa B. Ubnar from Reddy's Lab, and Secretary of the Vidya Jyoti, directors, my ex-colleague, colleague from civil department is Dr. Sai Baba Reddy. He is there, madam. Sai Baba Reddy.
He still didn't join, sir. Maybe he will be joining soon.
Directors, principals, heads of the departments, and the program officers of Vidya Jyoti Institute of Technology. Very good, and NSS volunteers of Vidya Jyoti. Very good evening to one and all. So really, it is a great privilege me to participate in the virtual mode. I have so first of all, I would like to congratulate management and principals, heads of the departments, the program officer for organizing revised guidelines for preventions and management of COVID-19 with the help of doctors. So you all know that because JN2 is always in forefront to organize and to help the society through to help the society by organizing these kind of programs. So we have more than 20,000 NSS volunteers across the state. JN2H is having more than 20,000 NSS volunteers across the state. And one of the active unit is Vidya Jyoti. I congratulate Giri Babu sir for organizing these programs. So last two, this is the third program madam saying. So really, I'm very happy. So really, because you are helping the society to by creating the awareness about the COVID-19. And we because already we have been organizing the different kinds of program through NSS platforms, like distribution of this mask or sanitizers, or any different food, also food to the needy peoples, and crowd managements at different places, like at markets or shops, or like vegetable places and slum areas and village. So helping all the different kinds of needy peoples and different levels, different programs we have been organizing continuously to create the awareness among the volunteers, and taking the help of volunteers. So creating the awareness to other peoples also, because already NSS volunteers are well disciplined students, and you all know that because they are all having the good discipline and having a good managerial skills. So with their help, we are organizing, helping the other peoples, creating the awareness to the other student volunteers, students or peoples who are living in slum areas or in marketplaces and different programs like that. So we are again, we are happy, very happy. So because you are organizing the this program, preventions and management of COVID-19. So first of all, I congratulate all the managements and program officers for organizing these programs. Thank you, Varnal.
Thank you, sir. Officials, let me introduce myself. I'm Lata Reddy from DRFHE. Dr. Reddy's Foundation for Health Education. So we warmly welcome you, and our heartily thanks to Doctor for giving his most valuable time in this tough situation. And we are glad to have Doctor's presence with us. And Doctor, let me update you today. 3 corporates are there with us today, who have joined. 3 corporates from. And without wasting time, let me hand over the mic to you, sir. Let me update you. Now it's a COVID second wave, sir. People are so panicked, are at home. After we being at home also, people are affected are down with COVID. And in every family, if you see someone or some other are down with COVID, so people are so panic. And now the black fungus, which has been attacking in people and kids also, which we came to know, sir. So we'll be glad to hear from you. And the prevention of this COVID, the second wave, and the new virus which is coming up. And we have been listening in the TVs and the media that it will attack for kids. So, sir, your advice, your suggestions will be kind of a tonic for all of us to, make ourselves alert and to be protected. So, without wasting time, let me hand over the mic to you and the people, official, corporate people, whoever are there now on the page. So this session is one of the foremost important session. Please spare half an hour of your time. And if you have any queries pertaining to the COVID second wave or anything, without any hesitation, please drop your queries in the chat box. Doctor will answer for you. And sir, if you could present in English, that would be great, sir, because many people have joined, sir. Thank you.
Yeah. Hi. Without wasting your time, and I just had my food in 10 minutes now. I just finished my COVID rounds in the morning, and it was very tough. And it's our responsibility that our healthcare system is not overwhelmed with this kind of cases. And a person who are working, and especially pulmonologists and ICU people, they are really geared up for the work, but the infrastructure and everything has to be taken care. The oxygen shortage, the remdesivir availabilities, the new drugs, the new changing the dynamic nature of the disease is causing too much of a problems now. Of course, there are problems. We need to accept that, and we need to rectify and how we can come out of some problem. No problem will be permanent, and there will be the problems will be permanent. Solutions are temporary, and so the problems are ever changing, and we need to address those things. That's why we are there in meeting. And as we all know that last year it was a wave which we are able to handle because of the lockdown and other things. The cases were less. Now we are facing a second wave with a sudden surge of cases, and now we have already systems in place. Now private hospitals have been taking the cases, and there is a vaccination drive which is going on in rampantly, and the virus is modifying itself into a double mutant and a Indian variant, UK variant, and which is fast progressing. And now in a third phase, we are saying that pediatric age group is going to get affected. Earlier, it was more than 65 and 75. They get affected means they will have a COVID complications and die. Then we started a vaccination more than 45 and younger patients with comorbidities, diabetics are dying. And we really don't know. The virus is becoming more virulent. And sometimes as the disease progresses, the only way we can stop or we can have a decreased number of COVID cases is healthcare should get a breathing space to admit few cases and treat them properly. And second thing is, as early as possible, 60% of the population and develop a herd immunity. That is going to be a challenging task. And vaccination is the only tool which we are having, which we need to increase it to such extent that we should not have. Vaccination will not prevent 100% COVID, but severe illness will be prevented. And the shortage of vaccines and other things, these are the things we are seeing in a second wave. And a new thing which has come in a second wave, which has, because we have treated irrationally, rationally, because which available knowledge, which was being there at second point of time, only steroids and oxygen are going to be a good therapy, but the timing of usage and diabetic, and we have overused, and the guidelines have been this thing that will precipitate a risk. Steroids and diabetic will precipitate a risk of having a new infection. When a COVID happens, even if you treat with properly with the steroids, sometimes the immune suppression will happen, and normally the fungus grows on a bread or anything like that. But if your immunity is less, they may just catch up the fungal infection, and we have seen people losing the eyes. And availability of amphotericin is, they have created a black fungus unit, and that's about the second wave now. And that is so challenging, and we have lost our own close relatives, family. Nobody is immune to that. And I have not heard any single person, including doctors, CEO, hospital management, big hospitals, all these people, they are immune. Somebody somewhere down the line, they would have seen their relatives suffering and asking for a bed, and that is becoming a challenging task to help them. And sometimes we are unable to help to provide the bed in that kind of situation. That is about COVID wave. And just to know that, I would like to reiterate very simple things, and I will not waste time in repeating the same things. And most of the time, it's so much of knowledge and information available on a TV, and sometimes over information, we will get wrong informations. I would try to give information which is just enough to have lead our practical life, day-to-day life very easily. We know that it is affected by a SARS-CoV. It has from a Chinese market. It has been evaluated. There is a lot of hue and cry about it is a lab error and other things. We will not dig deep into that, but it is a viral infections, and it normally causes a self-limiting. It just comes and goes. Every time we used to be afraid, I had a viral infection, I took Dolo and I recovered. That's what was our saying before. Now, if there is a viral infection, we are afraid that it will be COVID. And we have seen influenza and other things. This virus, it enters through a nose by airborne infections. And when it goes into the lungs, when somebody coughs and sneezes, it affects the other human being. That's how it transmits. Virus is a smart and a fast replicator. So it spreads person to person, human. And people who have their own immune system is good, means they can sustain that virus. Some people, they may require some Dolo. Some people may require multivitamins. Some people require antiviral. Some people require hospitalization. Some people die because of that. And problem is, if the numbers are too huge and no healthcare system in the world will be able to have that kind of hospital infrastructures, including India, and we are blaming all Indians and the way we have handled the situation. But the population is so huge that and we have so much variety of the cultures and the state systems and other things, and so far we have managed well. And from 50 years we are not trained infrastructure. We don't have a big hospitals and other things from the government sector, neither we have a good institution where we have a good researchers and other things. But in last 20 years there's a huge private hospitals and all. Now they are catering to the needs, and specific therapies are happening. And we need to face the challenges, and we need to solve these issues, and it is our own responsibility. It is a responsibility of citizens. It's a responsibility citizens of doctors. It's a responsibility of administrators. At every level we should be responsible, and somebody can't become a scapegoat of some things. And we doctors, we have limitations at every point, and hopefully we should come over it, and definitely we will going to come over it. And this infection, SARS-CoV-19 infection, is airborne. It spreads by droplet infection. So when we cough and sneeze, that's why the physical distancing of 2 meters, now it has 6 meters, and all the distance has come down. If somebody is a susceptible host, we cough or sneeze, mainly it is airborne. That's why we are wearing the mask and we are maintaining a physical distancing. So sometimes after that, it can stay on the surfaces, it can stay on the masks and all. When you touch and this thing 8 hours, it can stay. So soap and water kills it, and sanitization kills. We normally use sanitizations, and we are doing that. These are the standard therapy of preventing of COVID infection. One is the physical distancing, and this is the concept which is involved, why we are saying that. And most commonly, as 1.5 years of COVID, it is airborne only. You don't have to think too much into this. Airborne is the most common route of spread of infection. They say it can be spread in a water, it can handshaking and other things. We need to be very sure of it, but most common route is airborne infection. So human to human transmission, and it is really, really infectious. So that's why we get in a pandemic once in 100 years after Spanish flu, and we have not seen something in our lifetime. Last my 42 years, I have not seen like that. I have heard the stories of plague affecting when my grandfather used to tell about these stories and other things. So when India had these kind of problems, but this is something which is unimaginable pace. It is increased, and because of lockdown, and the number of cases have been coming down. So route of transmission is airborne. We know that they are droplets, and this can cause infections. So that's why we do all kind of screening, temperature and all those things. So direct contact, when direct contact is a major route. That's why human to human transmission, public places, cinema theaters, schools or colleges are locked down, and major institutions, corporates, they come with the workplaces and other things, they are closed down, and most of the time they are working from home, and they are privileged to do a work from home. But unlikely this can't be done in other professions, like in doctors. They have to be physically present, with barriers of communications, with barriers of treatment, and we can still offer good amount of treatment, because The problem is we have to wear the PPE and go in and treat them. And that is uncomfortable, neither for the patient and uncomfortable for the doctor also, because there is limitations, and uncomfort for the patient attenders to listen how are their patients' relatives. Thanks to the technology with the teleconsultations, and thanks to the technologies with smartphones, people can still see, and we are overcoming this. And I can't imagine if you don't have this phone and all those systems to update, then it would have been a very difficult task for us. So spread of germs, these all things we knew: 6 feet distance, sneezing and cough etiquette, somebody has to cough, spit, all those things we need to follow it carefully so that we don't spread the infections. I will just tell one instance. A young fellow came to my clinic, and he's a banker, and I said it is a COVID infection. The problem is, in a pandemic, unless otherwise proved, if you get a fever of 3 days and viral fever, it will be COVID only. Unlikely you can have typhoid, you can have everything. But the problem is denial from them that I don't have a COVID. I went to some hospital, take some injections, and it's not COVID, sir. You please do the test. It's just test. They are scared of testing. Or presumptively you take the treatment and he improved. And I said, you self-isolate yourself. Self-isolation, it's not the government responsibility. It is not somebody else's response. Self-isolation, if the doctor is told, and that can be easily done by maintaining a distance and wearing the mask. The problem is he did the RT-PCR after 8 days because it has a sensitivity up to 70% only. If RT-PCR has sent negative, and he has went to his father-in-law's place, and after 10 days he has recovered. He is young, he can sustain that. He's thin build, he's fine, he doesn't have a diabetic. But father-in-law, after 10 days, he came with 70% saturation. He's almost died, gone on a ventilator and died. So that self-responsibility of self-isolation when you're having a fever, because it kills the elderly in the family, because it takes their complications, chances are very high. So we are worried about the grandchildren who are getting infected. See, my kid is having fever, their immunity system is good. Now we are saying in third wave, it can cause in pediatric age group also. So far, and thank God that virus is not affecting the kids as of now, and normally their immune system is so robust, their thymus is to get rid of this virus very well, and they just recover with zinc and multivitamin. Very rarely they have a complication. So the parents will be thinking about the kids, and they actually don't know, and the symptoms will be less in an elderly. That time they detect them, their saturation is low. Most of the grandparents have gone in these COVID situations, and we should be careful about the elderly, and we should protect them. It's not because of we ourselves, we can sustain because of your immunity, and we should always be careful that not to infect others. So that is a public health responsibility, and the hospital, when these people are not doing it by their own interest, and we need to get a force, and sometimes they may call the military, and they may call marshals to get us controlled, be locked up in this thing. This lockdown will decrease the number of cases, so that the hospital numbers and other cases will decrease, because lockdown will not cure the disease. The number of cases will come down. So these are the things we need to follow to stop the threat. Whenever you are coughing, having sanitization, these all things you know, and you are been hearing from last 1.5 years. And even a kid, my own kid who is 4-year-old, you tell what are the preventive steps you take, they tell like a by heart, they will tell that. So that's why social distancing and usage of mask and sanitizing are important. That's are the more preventive step. And the way to use the mask, N95 mask, usually for a hospital system, if you are visiting your relative who is admitted in a hospital with COVID, wear N95 mask. That is more protective, because the spores which will not enter by inhalation. Sometimes a good gears and all we use when we are closely doing a bronchoscopy or intubation and these kind of things, and we wear full PPE. So in a general public, and if you are going in a nearby park and all, simple surgical mask or a cloth-based mask is also okay. But hospital areas and areas which are hot spots, we should be careful. Avoid wearing the N95. It is slightly costly, and changing every day will be a tougher task. And N95 is better if it is preferred. And now we will get it at a cheaper rate. We can use it, or simple surgical mask. Mask is definitely protective. So the next thing, wearing the mask properly. Sometimes we've seen that they are wearing in the mouth and nose. We are this thing, both nose and mouth are covered. Whenever you cough and sneeze, it will get affected. This we all know. This is the way to protect, and we can see their additional mask, sometimes double mask they are using it. They use one surgical mask or N95 mask. They will try to, and even the eye contact, they use the glasses, and sometimes the face shields are being used as a protective tool. So as I go nearer to the sicker and sicker places, we use more and more protection. full PPE is the best protection. That in the dead body who are carrying, and immediately COVID patients, they are using a full PPE. Hospitals who are seeing in ICU and other places, they are using PPE. Other places, they are using N95, face shield and gloves. And these are the way of protections. The protection increase has to be highest level. It's not that it can still infect with the surfaces. The way of doffing and donning the PPE is also important. And this is the way we need to protect. And mask will definitely protect, and distance will protect. Unless we know, many people, we are the culture of welcoming the people at house. You used to call them, if somebody knocks the door, we used to call, please sit, have a tea. This kind of system is gone now. We are afraid if a carrier guy or if your own relative is coming and somebody is died, we are afraid. So we can still do that by maintaining a distance, wearing the mask, and be compassionate who is COVID affected also, because tomorrow it might come to anyone. It's not that COVID affected person, he did all lapses and got a COVID. Since it is very, very infection, we never even know how we got the infection from sometimes. So it is so highly infected. So in a second way, it is killing more because we are burdened more. And whether it is due to a virulence of the virus, and whether it has become stronger and become mutant and killing more, or it is taking up more anger, and vaccination drive itself as increasing it, because many people are running around in rushes and for the vaccinations. That is one of the cause. So transmission rate was very less in first wave, and now it is become highly transmissible. It's taking much faster rate. So we should gear up for the need of COVID in the real life. So symptoms, as you know, symptoms of COVID. Some people are primary contacts. Primary contact, they have had some COVID. He has gone and visited. He has not even have any symptoms. He has got that test for surveillance. Then he got a test positive. First 5 days, they will not get any symptoms. They may remain asymptomatic for 14 days without even getting symptoms. Some people, after 5th day, they start developing cough, cold, and other things. 6th or 7th day, they don't even have fever and other things, and they may become suddenly breathless and go to a emergency. So even you don't even know, sometimes the oxygen is less. We need to check the oxygen saturation by pulse oximeter. It's simple handheld device where we need to maintain more than 94, 95. That's normal, 95 to 100. So elderly, it will be around 92, 93. So cough is one of the symptoms. Since it starts from the nose, it starts from nasal itching, cold, cough. You should have known sore throat and generalized body pain and myalgia. And sometimes it may cause breathing and chest tightness, and sometimes blood in the sputum. All those things can happen. Fever and chills, the high grade fever, which is not coming down with paracetamol 2-3 days, muscle aches, body aches, vomiting, loose motions, even a GI symptoms, it can. Most of the time, they would have gone to a gastroenterologist, they would have done endoscopy, colonoscopy, and they would not check. They can have GI manifestation. They might have a fits and come to you with COVID. They can have any other presentation. They might have had an accident. They have come for a fracture repair. Incidentally, they have got a checking as COVID. Loss of smell and loss of taste is absolutely specific for COVID, and somebody is complains of that. Usually COVID will be positive because it's absolutely specific for COVID. And unconsciousness, they can come, drowsiness, and some people are not eating and they're just sleeping excessively. And these are the symptoms which we can see. Some people may not have fever at all. Some people have only cough. So it usually lasts for 14 days. It's the incubation period. First few days after infection, 5 days, you will be absolutely right. When we tell that you are COVID positive and you take this medication, I am fine, I don't want to take medication. That's the way patients will behave. And 5th or 6th day, when the symptoms become, means they want everything. So we need to pick them early and treat them early. Then we will not end up in hospital, or we can just treat them in a home-based setting. And of course, there are risk factors of progressions, and some are high risk, aged patients, diabetic, hypertension, heart patients, and those kind of cancer patients. Those patients are at high risk and they may end up in hospitalizations. So we should be, these are the symptoms: cough, fever, shortness of breath, sore throat, and it can come alone or in combination. Sometimes headache. Headache is an important symptom. As you are saying that your mucormycosis is increasing. Sometimes post-COVID, they keep on telling of headache, then there's suddenly some swelling in the head. Yeah, we do a MRI, we need a swelling there, the fungus might growing, my ENT surgeons can remove all those things, and we do the testing, it might come as back fungus. So when treatment, we should be careful. Earlier, we didn't know much about what about the COVID, and we use steroid. Now we have a streamlined guidelines. We have a specific therapy. We know that remdesivir, there are a lot of use and cries about. If we use it proper time, remdesivir works, oxygen works, and you keep it. There's no need of taking unnecessarily medication, 30 to 40 medications. They are very simple medications. Antivirals are required, and sometimes few antibiotics are required, and my immune boosters are required. Very low dose of steroid if they are really oxygen is low and some toxic signs are there, we need a low dose steroids, and blood thinners because it can cause stroke and heart attack. Blood thinner, blood will become thicker, and in COVID, these are the common treatment modalities which we use, and use it legibly and sensibly without panicking, and people prevented from complications. So sometimes in diabetic patients, when we give it a steroid, their immunity is suppressed. They are more prone to a fungal infection. We should be careful if there is a facial swelling, and this wave, especially this year, we are seeing lots of black fungus. Black fungus is not a viral infection; it's a fungal infection. Fungal infection, it has to be treated. It has to be treated for longer duration. It can affect lungs, but it affects nose, eyes, and brain, and people can die. And it is much more horrible, and long-term treatment and antifungals are more toxic drugs, and there is a shortage of that drugs also now. And we need to gear up for that also at back end, and we need to decrease the number of COVID, and we need to prevent also. All these things has to be done in a combination, and then only we will be able to see pre-COVID days. So first few days, we said up to 14 days, average 7 days post-exposure, they can have social distancing. We can maintain home care tips for mild cases. Mild cases, home care means, and I have seen a lot of software engineers and all home care, they're young, their immunity is good, they are bodybuilders like that. They have stayed at home, got fever for 6-7 days. The BP has gone down, they have a cardiac arrest and died on a ninth day. I think that is a wrong thing to do. You should always ask for help. If you are IT guy and other patients who are young also, if you have fever which is more than 48 hours, just consult a doctor. There are a lot of apps which are available. Lots of teleconsultations are available. Even if you take paracetamol, do certain tests, you can get a test by going a home-based collection. Samples can be done. Why you are afraid of getting a COVID test? And it's nothing like that any person can get it. You can get a throat swab done. You can do a few blood tests done. X-ray sometimes requires a visit to a setup going to that, but you can monitor pulse oximeter. You can get the pulse oximeter from Amazon, and there are a lot of things which you can do. But just by ignoring and sitting at home is not, and you should choose yourself whether you can stay at home, take guidance, take help, and take a right medications. And home is the best way to get you treated. That's what I feel. Because hospital is like a jail-like situation. They are overburdened. The nurses are overburdened. There are more sicker cases to see. If they see you sitting and reading a paper and you are okay, they feel that you are okay, and you may not be addressed properly. So the hospital should be reserved for sicker patients. Most of the time, there are certain medications, antiviral and other things. Use the hospital correctly, but sometimes if the bed availability is overwhelming, people are afraid, they electively go and get admitted. So you need to take rest, good health. Usually virus, the faster it comes, the faster it goes. So 14 days is the time we need to be monitored, and 14 days is the time we need to be isolation. Some people, they just recover by isolation without even taking any medications, and we are lucky. And since it is unpredictable, earlier they used to say that if I quarantine, everything will go. If it quarantine, you will not be infective a stay. So if quarantine alone used to be, then we should not have a death. So which patient will remain asymptomatic for 14 days, which patients will suddenly worsen, it is unpredictable. That's why COVID is causing a problem to the doctors. COVID is causing a problem to the community. So this 14 days observations is very, very important, and never get into a situation where you need to beg and borrow for the bed, ICU bed, hospital bed, oxygen bed. Things, if you have addressed 3 days is a longer time in COVID. So if you address the problem earlier, 2nd or 3rd day of fever, you can get cured in the hospital. You wait for 9 or 10 days, you are allowing the disease to take over you. And by that time, when the disease takes over, to treat it and get back to a normalcy, it still takes a longer time. So better you treat early at the home is a good thing to do. I will just focus on those things because hospital is a jail-like situation for everyone now. And doctors are overburdened, overworked, and the shortage of remdesivir and other things, oxygen and other things, too much panic situations are happening. So hopefully government is getting more oxygens and other things. But these are the things we have to do at isolation. Wear the mask, protect your kids, use separate bathroom, and wear N95 mask, wash the hands, surfaces should be clean, use sanitizer. So let's make a promise that I will improve in home isolation with proper teleconsultations, with proper way of doing the things, and ask the expert when we need to get a hospitalization. If it is 92 and less oxygen saturation, if you are really tired, if you get a seizure and sodiums are low, those kind of situation, that time we are helping the community also, so that eligible person will get a bed. And that's kind of a situation which we are facing now. So you need to drink plenty of water, hydration, because if you don't hydrate, the blood will become thick and you are prone to blood clots. And you need to exercise, so your circulation of the blood will happen much, and will not have much of problems like heart attack and other things. So these are the things we do at home. So temperature and pulse oximeter monitor. At least if you monitor the temperature, if temperature is not coming down with whatever we are giving, then you need an admission. So if the temperature is coming down, the disease is responding with the medication. Pulse oximeter is a handheld pulse oximeter. Sometimes we can wear the pulse oximeter. If it is 95, walk for 3 or 6 minutes, check it. If saturation is normal, more than 95, don't get panicked, even if it is COVID. COVID is not an emergency. COVID complications and saturation low is an emergency. If you are COVID positive, maintain your calm. Your adrenaline surge should be lessened. Maintain your calm. Maintain your calm. You will not be treated like before. So when you go to that, wait for your turn. No ER will welcome you. You feel that the surrounding world has become ruthless for you and nobody is addressing. Your neighbor is not picking up a call. Your neighbor is not helping. Your friend, your closest friend, you think he may not come to help. Your closest family doctor says that you go to the hospital. So you use the phone call, you be at calm, see your saturation, get the pulse oximeter there. See, if you maintain your calm, things will improve. And there are a lot of self-help group and many people are volunteering. They will help you, they will guide you. Your BBMP is guiding in Bangalore, and there are a lot of helplines and other things. And get yourself treated by consulting properly. So sometimes pulse rate will become high. Pulse rate and saturation is good. You are not even checking the BP. Sometimes it is going to be tough. They may develop giddiness and fall in the bathroom and they become unresponsive. So BP is one thing which is going to be difficult, but some people will have BP monitoring which are digital, which can do a good job. So we know how to use the pulse oximeter. We need to use it in this thing. Nail polish will help and all those things. Nail polish, whoever wearing the nail polish, you don't use that finger. It will falsely sense it as low or high oxygen. So check it properly, get the pulse oximeter, good quality one, and check it properly. If it is above 90, enough, wait. If it is 94 and above, it's very good. So pulse oximeter can detect the lung diseases which has affected of the lung with pneumonia can be done. So disinfection is important every day. What we do it in home, cleaning with 1% sodium hypochlorite solutions, and even simple soap and water can be used. Caregiver has to be more compassionate, because sometimes the COVID patients can behave like a psychiatric patient. Once you are affected, a person who is cool and calm always, and when he is affected with COVID, you see the behavior is absolutely different from what we see. That I have seen in my own eyes, and after their COVID recovery, they have become normal. So that's how that stress and anxiety can cause to the patient's behavior. So caregiver has to be protected, because I have seen patient who is taking care with the oxygen low, they are affecting and they are getting the bed. So there, your prevention is also a utmost thing is safety of yourself and protection of yourself. Then you can offer the treatment for others. I am doing it from past years. I am not been COVID affected. I am been vaccinated with Covishield 2 weeks earlier. We said a lot of hues and cries about not taking COVID vaccination, that, this and all. We had lot kind of problem, and government is offering free in Geneva. We rejected the offer. We said a lot of things about COVID. It's not approved and other things. Now we want to get vaccinated. The problem is vaccination shortage is there. So healthcare workers, even among doctors, they rejected. They had their own formulas of thinking vaccine will be definitely protect you. Please take the vaccinations and be protected. At least you will not get severe illness. So seek medical attention if a mental confusion is there, oxygen saturation is falling less than 94 persistently, and if there is persistent high-grade fever, breathing difficulty, you need to seek advice. Sometimes we don't have anything, any tool. If saturation is borderline, we have pulse oximeter, you're staying in a remote place, 93, 92. The more thing which we can do at home is lying down prone. If supine position, normally we have seen all animals, their back is above. If you see, they are prone. We have evolved and we sleep awake like that. That is not good for the lung ventilation. So whenever the lower lungs will not be ventilated properly by making supine. So because lower lung will be ventilated properly, when lower lungs are ventilated, they have large areas of ventilation, your saturation improves. If they are borderline 92, you can just get your saturation from 87 to 92 by just doing this and properly getting a good ventilation in the room. So if you don't have oxygenation, and that time you give a specific treatment, they will improve. And this prone position definitely helps. Yoga, pranayama helps, breathing exercises help, incentive spirometry help. And this is the simple things which you can do. And if you picture itself says much more than what is the real this thing. So if you do that, it will be more helpful. So this is about RT-PCR. RT-PCR negative will not rule out COVID. So I have tested 4 days of fever and I have tested RT-PCR. It has come negative. It doesn't mean that RT-PCR is negative and you have COVID. So 70%, if it is done in 5th to 7th day or 8th day, COVID will come positive. You can still be COVID if you are symptomatic, you keep testing, or you do a 7th or 8th day CT scan. You have a ground glass classical appearance of viral pneumonia, then it can be COVID. You don't require RT-PCR and it can be treated like COVID only. Don't delay, and don't deny. And it will be COVID most of the time, even if it is slightly expensive to do certain things and do rule out. If you are symptomatic, definitely we need to evaluate further more with the CT scan and other things. So, but routinely doing on a first day of fever CT scan is also not good. Usually viral pneumonia, they replicate, they go into, they just march to the lungs and cause pneumonia. When the pneumonia happens, your oxygen falls, you end up having 1 liter, 2 liter, 3 liter, 5 liter, up to 60 liter, then ventilator, then death. That's how the COVID will kill. The more and more lungs get affected, the more the oxygen gets affected. So first 5 to 6 disease, if you're not allowing that COVID virus to march into the lung and cause low oxygen, that's where we can treat it at home. So if lung is involved, if oxygen is borderline, we may require steroids to remind that steroids are a wonder drug. We are blaming it for black fungus, but this has to be used judiciously, especially in diabetic. So symptomatic patients, after 10 days of viral infection, virus is gone. After 10 days, the remdesivir doesn't help. In a viral phase, first 10 days or 12 days, viral phase, you can use remdesivir. And sometimes this, if loss of taste and loss of smell is there, definitely it will be COVID. So you just have to address that problem. So retesting, and don't be bothered that COVID comes negative after 14 days. What happens between COVID positive and COVID negative is important. It is not caused so much of problems to you. So COVID, most of the places I have seen people traveling with RT-PCR negative and the CT is showing they are still coughing. They are traveled in a flight because the flight will accept only RT-PCR negative is coughing and it can infect whole people. So RT-PCR negative is the right tool. If you don't have any fever, you don't have any symptoms, and if RT-PCR is negative, it will be negative. Then we can allow them to travel. So these things are important, and taking precautions is important. So once you get vaccination, you immediately will not be protected. It takes at least 1 month for the antibodies to develop. At least 6 weeks to 12 weeks is the second dose that they are recommending as a booster dose. When you take 2 vaccines after 1 week or this thing, you have sufficient antibodies, you are protected. I have seen patients are getting vaccinated, taking a Facebook photo and showing it everywhere and say that I am protected. It will not be protection from day, and next after 5 days they would have a COVID. That's how I have seen the patients are having COVID. So COVID vaccination takes, after taking vaccination, it takes some time to be protected. It will have a definitely, and the protection duration is not known. It's 3 months to 1 year like that. After infection, up to 3 months, we can wait to get vaccinated, or up to 4 weeks is the minimum we can wait. So vaccination we are giving for prevention of COVID. When you get COVID affected and you are recovering from the COVID, that's not the time for vaccination. You should take vaccination when you are healthy so that you will not get a COVID in future. Or if you get COVID also, our body is able to tackle it, this thing. So hydrochloroquine will not prevent, that's what we know. We used to use it, we still use it, and it can be a wonder drug, causes any pains and other aches. It can still be used properly, but there are a lot of trials have been shown that we are using all different kind of drugs. We didn't know we are using azithromycin and other thing. Multivitamin nutritions are good immune system. It may not be required, but most of the time we are helping to find out all the vitamins, vitamin D and all. They will be protective, and immune system will be good to tackle. That's where we look at treating with immune boosters. So if somebody is having symptoms, mild to moderate symptoms, he needs treatment with antiviral. either with favipiravir, or sometimes we are sick in remdesivir, and sometimes even anti-flu, whatever we use it for, oseltamivir for H1N1, it works if they are used properly. So any anti-RNA virus, there's no COVID specific treatment, absolutely wonder drug has not come. So this we will use, and this is the way we use it properly. So how to sanitize the masks and other things, UV radiation, there are a lot of things which have come, and how to sanitize your mobiles and other things. And drinking is dangerous. It's always not good to have. There are a lot of link between drinking and vaccinations and all. It's not good to have this thing because it increases dehydration. Alcohol causes a lot of dehydration. Blood will become thick. You are more prone to clots. No, antibiotics will not work solutions. Whenever there is a viral disease, we need antiviral, not antibiotics. Azithromycin is an antibiotic. Doxycycline is an antibiotic. Ivermectin is antiparasitic. We still use because you have an antiviral property or immune modulating property. That's why we are also used. I am also using. But antivirals like Tamiflu, Fabiflu, and remdesivir, we use it in hospitals. It's not given on OPD basis. And other drugs, we use it based on the duration in the first 5 years. And antibiotics, we don't use it early. That's the way we treat COVID. And I am seeing the number of cases have decreased in last 2 weeks. It's coming down, and lockdown has definitely helped. But our healthcare systems and getting an ICU bed for your family, it is really impossible. Nowadays, we are seeing, hearing that we are hearing that once you are ventilator, you are gone. So problem is we are ventilating at late because we are getting the bed late, and we are not able to offer this thing. And this barrier is causing a lot of problem. The amount of care we used to care for a patients at a bedside, doing the intubation, getting the proper NIV masks and other things, sometimes it doesn't happen, or sometimes it takes a lot of effort to get it happen. So then it becomes a challenging task, and no amount of ventilators and getting the no ventilator, 10,000, 20,000 ventilator is not a solution. Prevention is more important. So we should have less number of patients. Lockdown will help, and self-responsibility of not getting infected, or if you are infected, not giving infections to others. And some patients, sometimes they are not even bothered, doctors will get affected. They are ready to get cured from the doctor, and doctor's protection is also important. So you should take care of your doctor also. So because doctor will help a lot of patients to get recovered. So most of the people are selfish sometimes to get cured, but you should be responsible enough to take care of their own family members, their own elderly people, not to infect them, self-isolate, and do whatever best you can do not to infect others. Get yourself treated. We don't want their COVID care centers. This thing, get your treatment, not getting into a complications of ICU bed and other things. And even in the ward bed with oxygen, address the problem early. You will not need an ICU or a ventilator. Once it is ventilator, it's too difficult task. The cost of treatment, the management, and the stress to the family members and attenders is too much of a toil. And so that's why when there is a COVID, you be protected, get vaccinated, use physical distance and mask, sanitizations properly, protect your elderly in the family. Don't worry about kids at this point of time. Second, third wave, I don't know, maybe a whole pediatrician bunch of doctors are preparing themselves. I wish that third wave to the pediatric age group will not happen, because it is going to be a very, very, very challenging task. And I wish everyone will be protected, and this work from home can be continued, and treat at home should also be continued. And I want to see less and less patients to the hospitals. I don't want to make a profit out of these health issues. I want this COVID to end as fast as possible. Let the normalcy resolve. It is our collective responsibility, including our government, including ourselves. Then only we can end the pandemic. And we can't just make a scapegoat of somebody, neither the government, neither the victim, neither the hospital. It is collective responsibility. Let's gear up the challenge and get this menace and get out of this huge pandemic, which has caused near total lockdown of whole world. And everybody is kneeling. Oh God, let this COVID end. Thank you. Thank you very much.
Sir, there are a couple of questions here, sir. The first question is, what is the period after recovering from COVID we should take the vaccination? Can children be given multivitamins as a prevention from COVID, sir?
See, the first question is, once you are COVID affected, so COVID itself has protected you from COVID. If you don't have a complications, you are taking vaccinations to get not to get COVID or not to get a COVID complication. When you got a COVID, you have developed antibody, you are not hospitalized and all, you have sufficient antibody to protect yourself. But if you still want to take a vaccination, at least 4 weeks, 4 weeks after the COVID affected, 4 weeks to 12 weeks is the time. Up to 12 weeks, anytime you can take vaccination, but 4 weeks is the minimum. Now government is minimizing and increasing the durations to 84 days or this thing, because the first dose vaccine has to go for everybody. That's how their strategy is there. But at least 4 weeks minimum after COVID recovery is the time to get vaccinated. The second question is there, no amount of multivitamins, no amount of this thing will protect you from COVID. COVID will be protected if you engage, do your healthy habits important. So getting up early in the, all those health needs, good nutritious food we should eat, exercise yourself, and this, and use the mask, social distancing, sanitizing, that will be most protecting. Taking, and people have taken kgs of multivitamins, and it's good to have a nutritious food, but how much you can take multivitamin every day, vitamin D, vitamin C, vitamin D. But if you have some product which you can home and it can increase, you feel that it will be protect you, take it adequate recommended qualities, and don't overtake more vitamin D, more so that we get a toxicity of vitamin D and vitamin A and other things. But you take multivitamin, it will be definitely some amount of immune boosters will help you. That can be taken.
Sir, one question to you. Sir, because when can we use recently developed drug 2DZ? So Reddy's Labs in association with the DRDO developed, no sir? When can we use that drug?
See,
sir?
the problem is many patients are becoming hypoxic. The Reddy's are coming up with some innovation, and it's Indian made only. And this was a nuclear medicine drug. Normally we use it. And whenever we give this drug in a powder form, the problem is the virus will need some substrate to replicate, means to double. So it needs some food. Glucose is the best food which is available in the body. It comes from a carbohydrate in a cell and what we eat. When you give some product to ourselves, that this product will be taken by the virus thinking that it is glucose, but it is actually 2-deoxy-glucose, which Reddy has given that. And that will not help to replicate further. So the virus will not replicate faster, and patients will not become hypoxic, means oxygen dependency will come down. So it will delay the replication so that we'll get some time to treat with other drugs also. So 2-3, I have not used much, but I think it is a promising one. Let's see how it is there. And since it is oral drug and it is cost effective drug, it can be taken with other drugs. 2-3G, I think it should be welcomed, and only time will tell whether this drug is a wonder drug or what exactly is it. But we need something more, because we don't have anything now apart from oxygen, steroid, blood thinners, plus or minus remdesivir, and no new drugs in the pipeline. So let's see how exactly it will evolve. People are asking for it voluntarily because of a lot of news, information and all, but it's not available on hand. Probably this May end or June first week, we will get it. And Reddy is also getting the vaccine from outside. We have only 2 vaccines, the Sputnik Russian vaccine. I think they are rolling out for a commercial purpose, and probably it is available for everyone. People are ready to pay 1,000 rupees also, government, to pay that and take, because vaccination has definitely taken up very well. Hopefully, once this vaccine production increases, we can vaccinate as much as possible throughout India and protect from severe COVID illness.
Sir, next
Thank
question
you, sir.
is...
Thank you. Thank you so much, sir.
Sir, next question is lifetime of virus on surfaces and objectives.
Lifetime of virus. Till humans are there, that's its lifetime. Virus will replicate it. See, yeah, a person's lifetime will go if it gets out of his body once he is dead. So it needs one more human body. Any living human being is a thing for it. So unless it has to get its virulence down, it has to become less and less effect like influenza and other things and die down. Or you develop your immunity by vaccinations and be protected to that. Or whenever it comes from human to human, that's the lifetime. So it may remain eternally. It may not die, or your number of cases or your immunity. That's why we are all talking about vaccination and herd immunity. And I don't know, lifetime is eternal, I feel. It's like Bhishma. Virus has, the life is there till your life is there.
Sir, next question. For adults, how much amount of...
14 days, as 14 days is the incubation period. It replicates, it needs one biological cell to reproduce. So if it is not your body, then it goes to other body. That's why it is transmission is happening. So it is replicate. It needs humans to stay so that it will replicate. So we need to stop the transmission and doesn't become a prey for the virus.
Yes. Sir, next question is, for adults, how much amount of dosage medicine can be consumed, sir, per day? Maybe this is referring to multivitamins, I believe.
Vitamin D and all, vitamin A, it's all there. People are taking from 3 months to year and all. Multivitamins and other things are protective. I agree. Definitely you can take, but they are not only the treatment for it. See, maintain your good health, good lifestyle, good nutritious food. They are all vitamins, everything is there in the natural food. You can take extra dose of pill and you can take 1 tablet per day. There are a lot of well-lumen medications and more than 40 medications you can take as a multivitamin. But just to be protected, taking overdosage is not good. So, and whatever in a lot of medications which are coming, they are for every mineral or every element in your body, you need a certain recommendations. When you see the new Horlicks bottle, they would have seen this contains this much, this contains this much. So anything overdose is not good. You can take multivitamin. That's what I meant to say.
Yes, sir. Sir, if a COVID asymptomatic, how many days that we need to go for a treatment?
It's 14 days. If you observe this asymptomatic patients for 14 days, if you don't develop any problem, you will not develop any problem. The problem is you might require certain blood test at the end of 14 days, whether your blood is thick or thin or D-dimer, CRP and all. But only quarantine should be enough. 14 days is the time duration which we need to observe the patients.
Yes. Sir, what is the reason for black fungus occurring while recovering from COVID-19?
It is very difficult question to answer and people are finding the answers. And most common thing, we are never used to see that much black fungus even if you use the steroids. Diabetes which is not controlled is the biggest risk factor for COVID. So the sinuses are more, we inhale everything. So we are exposed to certain bathroom fungus is there, spores. Sometimes we keep the old breads there and it has been affected by fungus. You have seen. So normally it doesn't have that capacity to enter a human body also. If your immune system is strong, our body immunity is so strong, it has all defense mechanisms to fight it out. So what happens in diabetic, your immune system is weak, and that is one of the causes. We normally use 1 or 2 cases occasionally with mucormycosis, black fungus, and on coughing you get a black color sputum, or nose you are getting some bleeding or black color substance like that. And if you develop any swelling, they did a surgery, they give an injection, that used to be heard. But now there are, one factor is uncontrolled diabetes. Second thing is when you are treating COVID, they are treating with steroids. And steroids, whenever we use, we need to control the diabetic because it increases the sugar. When steroids are given appropriately, it is used for a short duration just to get tide over the crisis. That is good enough. It is a wonder drug. It is like double-edged sword. Sometimes the way it is used in the community, it has a lot of questions to be asked. So some people are using day 1 of the fever without any problem. You give this steroids, take every day 5 days, like that they are taking it. So that's the way that treatment is wrong. That steroids use and diabetic, that many are saying the way we use the oxygen, the fungal after the immunity, wearing the mask, the same mask again and again, fungal, all those things are theories which are being proposed. And this fungal infection is a black fungus, is deadlier than COVID also, but it may not kill faster, but it will make you suffer. And there are low medications. The medications are toxic and we need to stay for longer duration in the hospital, unlike COVID.
Sir, chances of COVID spreading through objects?
It is there. Most of the time it is airborne. So you can stay 8 hours. Whenever you cough and sneeze on a table surface, you touch the table and take it to the nose and it may get infected. That's why we need, whenever you sneeze, you need to just wash the surfaces, wear the gloves, that's all. It is definitely gone by object, telephone and other things. But after 1.5 years, I was also afraid to carry anything on this thing. But I feel the mask, airborne, is the most deadly way of spreading the disease. Because by sanitizing and maintaining a social distance object, because virus will not reproduce or replicate when it is out of a biological cell. On a surfaces, it will not stay longer. It will die off.
Okay. Sir, is overdosage of zinc in body is favorable to black fungus?
Yes, there are a lot of things which have been studied now. So we are using multivitamin and all. What triggered, we don't know. Zinc and ferritin, there are a lot of mechanism which are being involved, because ferritin, iron, and zinc are normally used as a substrate in cell metabolism products and all. Sometimes when you replace it with a lot of zinc, and zinc will be protective. We don't know. The more studies have to come in future to tell that zinc is the cause for it and this is the cause. As of now, it is diabetic and steroids.
Okay, sir. Sir, last question. Sir, is that true that we will be testing COVID positive for a couple of days after getting vaccinated?
Yeah, I didn't get the question. Yeah.
Sir, is that true that we will be testing COVID positive for a couple of days after getting vaccinated?
No, see, this is a lot of questions have been asked. Vaccination will cause COVID. The problem is when you go for vaccination, you should have a protective environment there. So if you are exposed to more people standing in a queue, in a rush, you take it. We don't know somebody is getting COVID affected and you may get COVID. That's one reason. Second reason, the people who are asymptomatic, they don't even know they are spreading and they might have spread. Third reason, you might yourself have a COVID and you're not being tested, you don't have any symptoms. That's why there is a checklist. If there is a cough, fever and all, you avoid vaccination. So sometimes you test and check for antibodies and do it. So it may mimic like COVID only. That's the reason COVID will not cause COVID testing to be positive, COVID vaccination. So there are some additional factors which are involved in getting a COVID. And post-COVID vaccination, you need at least a month or so to be protected. Just immediately vaccination, we will not be protected from COVID.
Sir, with this, we have answered all the questions, sir. Sir, on behalf of Dr. Reddy's, I would like to... Yes, sir, with this, we have completed all the questions, sir.
Thank you.
On behalf of Dr. Reddy's, I would like to thank Dr. Hiranappa for giving his time on his very busy schedule, and also for all the participants who have joined from all the corporates, sir. So once again, I would like to thank Dr. Hiranappa, sir. Thank you very much for your session, sir.
Thank you. Thank you. Hope it was helpful. Thank you.
Yes,
definitely, sir.
And I would like to thank you on behalf of Vidya Jyoti Institute of Technology, sir. Your session was extremely wonderful and it has cleared so many queries. Maybe before all those questions that were running in the mind have been answered through your presentation itself. Thank you very much, sir. And we really understand how busy you are. Even that little few minutes for having your lunch also you have spared for us. Thank you very much, sir. We are very greatly indebted to you.
Thank you. Thank you, madam. Thank you.
So can we call it a session, sir? Prahlad, sir?
Yeah, madam, we can close it, sir. Thanks a lot.
Thank you, Pro.
Thank you. Thank you, sir.
Okay, madam. Really good session, madam. Excellent.
Thank
Very
you,
useful sessions.
Yes,
Similarly, you conduct some more yoga classes, madam, with the help of Heartfulness or any other people. So take, because that kind of really, because it brings all faculty and students from different kinds of stress.
Yes,
They're facing a lot of problem during these pandemic situations.
Yes,
Classes are not going on properly. They are not able to write exam properly. So this kind of what is the awareness